We've been showing you some of the long lineups at assessment centers across the city for the past few weeks now. The one behind me, some people have even brought some picnic chairs to help with the wait. But a private company is now offering to come to your home and do the test for you. No wait involved, but it isn't cheap. And medical professionals say this sets a bad precedent. A discouraging sight for those looking to get tested for COVID-19. With long lineups wrapping around hospitals and street corners, they are facing hours-long wait times, some centers even at capacity before opening for the day.
People are frustrated, they're upset, and they should have access to timely tests in order to get back to their lives and make sure that they're safe.
A company is now offering a service to get you out of the lineups altogether, but it will cost you. For $399, they say they will come to your home for private testing with results available 24 hours later.
It's just not fair, and that is price gouging. It's a great example of it, too. Something that could save someone's life, allow them to go back to work, maybe get their kids back into school, shouldn't cost people a single cent to be able to access that test. $400 is just astronomical, and it's unfair and it's unjust and shouldn't be happening in the province of Ontario.
The company says the cost covers a physician, registered nursing fees, in-home sample collection and lab drop-off, travel time within Toronto, PPE, third-party lab test processing, and test results.
Minister of Health.
In the legislature today, Health Minister Christine Elliott responded to the concerns.
We certainly understand that there are some private operators out there that are proposing some of these tests, and we're examining this in the ministry to understand whether that can continue or not.
Shame on the Minister of Health today for not shutting that down immediately.
But the Premier going a step further and actually defending the company.
I think it's a free market society, but I encourage people to go to the testing centers.
I really think it is shocking that the Premier acknowledged that he doesn't believe in public health care, that he thinks it's okay for people to be able to pay their way to the front of the line.
Medical experts believe it sets a bad precedent in an already uneven playing field.
We've seen free markets have disastrous results when it comes to healthcare and the provision of who needs care most.
Especially as COVID has already exacerbated so many inequalities and disparities in the healthcare system.
To see really this kind of predatory move to really capitalize on people's fears and anxieties and aspects of where there just hasn't been adequate testing capacity. Yeah, it's disappointing.
We did reach out to the company to find out more about the work they're doing, but they didn't get back to us before airtime. In the meantime, the province says it is going to ramp up testing to 50,000 a day, and they're also going to start setting up testing centers inside pharmacies to help alleviate some of the long lineups we're seeing at assessment centers.